at the department. So yeah, ditto. No, she went back to the airport. I don't know folks know she was a airline stewardess. So in a previous life, and so she moved back to that department, and I'm mad at coaching a really excellent employee. It's okay, we've had like 69 applicants for her position, so hopefully we will fill that very soon. And we have our new board members today, and we are joined by Dr. Aycock, who's here from the Office of Mental Health. So I think we will go around the room and say hello, although when we get to the president's report, we'll spend a longer time talking about the Office of Mental Health as well as Mike and Emma, although we've been talking about them in their absence quite a bit anyways, but we'll say hi in general right now. But Rashid, why don't you kick us off?
So, Rashid, welcome. Hello, congratulations. Official welcome.
And where do you're from the New York-ish? Yeah.
Erin Gottman, I'm the coordinator of student health services for the
But I'm the board president and here from U of R. And I run the community health improvement planning process. Just my other title. Everybody, and then with us Brown, Commissioner of Public Health. Really, really grateful for all of you being here.
Hey. I'm Beth. I'm the vice president of the Board of Health. I'm a professor of nursing at St. University and the assistant director of quality for the campus. And welcome to our new members, and it's nice to meet you.
I'm Emma Forbes Jones, new member.
Yeah, I'm Mike Weston, executive director of Kids Branches, and my first meeting with them.
Yeah, hi. Oh. April, director for Monroe County Health.
If you guys remember last meeting, Dr. A had asked for some, if she could kind of sit in and learn more, and said yes, of course, open arms, so.
Thank you for having me.
And
Hopefully
Sarah,
I can stick around for a while.
yeah, that'd be great. I know you're busy. Sarah?
Yeah, sorry for being late. So I'm Sarah Fletcher. I'm the deputy commissioner of the Department of Recreation and Human Services. I am the city rep.
Mike and Emma are new board members. And, you know,
And in the back, we have.
Oh, I'm sorry, you didn't get community engagement director for the health department. Yes, that is another announcement. We are eventually going to be broadcasting like city council meetings do, just to allow us to also zoom in when we have to miss, but also to be transparent and all the things. So Megan is graciously working through that technology with us. So today we are testing out the Zoom. We're not officially broadcasting to the public, but we are working on that technology so that we'll be able to in the future.
And making sure everything will run smoothly as we move forward with this.
Yeah. Did I see Celia's name up on the screen?
She has Otter AI. She has a note taker
Oh, okay.
that's
So
signed
she's
in.
not actually on.
Correct.
Oh, okay. Does that automatically turn on when somebody says yes to the meeting? Is that what happens?
If you have your calendar linked to Otter, you can put all of your Zoom meetings into Otter and then it will automatically log in and take notes of the meeting for you.
Yeah, I have a meeting where somebody has something like that set up, and every time there's a meeting, it says, here's the pre-notes, here's the da-da-da. I'm like, no, I don't want any of that. I don't know how to turn it off. For me, it's not me. I don't
I
want
think
to.
you can turn it off. There's a way, yeah, I think it says you have to put something in the chat and then it'll turn it off. But I don't know if
He
it
can
turns it off.
do
for
it,
that
I'm
person.
good with that, but I don't want all of it.
Yeah, that's right.
Because it emails us. All right, we have an order of business to review and approve the minutes from January 6th meeting. And there are 7 of us, so that's majority from the 11. So you all were emailed we're gonna get used to new services here. We were emailed the minutes. Hopefully you had a minute to review them. A minute. I have them here if anybody needs to glance through them. But if somebody wants to call the approval,
Yeah, oh,
move for the approval of the minutes, great. At that meeting.
Who seconded?
I did, Aaron.
Aaron? Any conversation about the minutes, edits? All in favor of approving the minutes? Aye. Anyone opposed? Abstaining? All right, minutes are approved. Thank you all. You all should have also received the list of meetings, which are the first Mondays moving through the calendar. The only change to that is September 1st, which is Labor Day, so we're meeting the following week. And I believe meeting invites went out to everybody. I believe you sent those, yeah. So if you don't have them, let me know and get them on your calendar. And they're all in person. And if there's an emergency, just email and you'll figure out how to get you in. You should have also received the membership list, an email, and we'll talk about membership group. So that brings us to the commissioner report. And our commissioner.
I have.
Shut down.
All right, go on.
No, it's been a challenging couple days for many people, and anyone trying to practice good public health. So, there is a federal funding pause until February 10th, which then maybe injuncted or whatever the legal term is. To stop that, it has everyone very concerned, about the grants that funnel from the federal government to support work in every division of my department. And so in discussions with Frank Lozano is the business budget, non-programmatic finance, like so important. Does all the stuff that I don't want to do but needs to be done in this department. We're talking about possible, if all of the direct federal funding were cut off, that's a total of $6.7 million that I would just not have in my budget. And that does not account for all of the pass-through federal funding that goes to New York State and then down to local health departments. And so we don't even have a good accurate picture of what the full damage could be. The State Department of Health has met with the New York State Association of County Health Officials and tried to calm concerns in the setting of they don't have full understanding or clarity either. So there's a lot of uncertainty and that makes people uncomfortable. So I am telling my staff to keep doing the good work that they do until we have reason to tell them otherwise. But there's just a lot of anxiety. And I have set up a reintroduction of sorts between our department and all the K through 12 school districts in our county, mostly to make the case for why it would be really, really important that all the districts continue to participate in the youth behavioral risk surveillance system. This is a survey that's done every 2 years of kids. It starts in middle school, but most folks know about it in the surveying of high school students to ask about all kinds of behaviors, sleep and screen time, and sure, ask about sex and drugs and rock and roll and, you know, all kinds of behaviors, but also bullying and what kind of choices are people making about how to protect themselves when they're engaging in whatever type of sexual behavior. And so that meeting has been in the works for months. And now my staff tell me that 20 plus years worth of national comparative data for the YRBS is just off, has just disappeared off the CDC website. And so that is, again, very, very concerning.
Does New York State data disappeared too, or is it just federal?
Prevention agenda was up on Friday. I don't know what it is today. It's a day-to-day situation.
Not had the bandwidth nor the real
I was just
desire
curious,
to
I think it was just
confirm that
removed
that's
from
gone
the
too.
state.
Yeah. I was just,
I'm sorry.
it's fine.
It was-
I was
All that
curious.
information was removed from the CDC website.
I don't know. This was the first week that the morbidity mortality weekly report was not released from the CDC in 60 years. And so I don't have any national data about H1N5 avian flu. There was supposed to be a bunch of information and then a follow-up call for, public health practitioners to zoom in and learn national data. And so that's on hold. It is concerning to hear reports about pulling out of the World Health Organization when there's an active outbreak of Ebola going on in Ghana right now. My understanding is that the impact might be delayed a year, but this is not the time to have less data sharing when we are undoubtedly going to see more diseases come into our shores. We're an increasingly interconnected world. So this is just lots of negative news of late. And folks ask, what can you do? My normal answer of calling your senator, calling your congressperson doesn't really make that much sense, because our New York State senators and congress members for this area, at least, are all represented by Democrats. We're not broadcasting, so I'll just say I doubt the president will be swayed by arguments from folks outside of his own party. So trying to keep moving forward.
I do know that the New York delegation met with the county executive and mayor about this issue like on Thursday. Thoughts on this? Because obviously
Marie
we're in the
does.
city as well. But I know that there's at least a meeting planned. I don't know. Yeah, I'm assuming it happened. So I know that there's conversations happening.
It was a conversation.
Yeah.
So that is, yeah.
If 6.7 million in funding is gone, and say that it really is gone for good, like we don't get it back, what does that mean for our health? Like, do we close down? Like what happens?
I don't even know how to answer that question, because we have state mandated requirements, like we have to inspect restaurants to keep people safe from from foodborne illnesses. The WIC program is not at all funded by any county funds, but national WIC, I believe, is a little bit more communicative, and we haven't heard that funding is going away. So it is very program specific, but there are a number of other things that my department does that are not mandated, some of which is super critical, like Starlight Pediatrics, the clinic for children involved in foster care, like providing trauma-informed holistic primary medical care to the most vulnerable population in anywhere. Is that gonna be cut because, I need to use funding, whatever funding I have to do other required work? I don't know. Obviously, cutting positions would be the last thing we would wanna do, but what does that even mean? Do we redeploy people that were hired to the medical examiner's office to do something? I don't know a good answer for that. Trying not to panic and not think down that fatalistic road, but we do have to think about what would we have to do. But there's so lack of clarity, it's hard to plan.
Are the county health department directors, either in New York or NACHO, giving any guidance or getting folks together? We start talking about things.
Met and discussed a number of things, such as maybe we stop sending out our public health vans with our decals all over them to work with undocumented populations, for example.
Well, sure,
What if I
that's-
just follow
yeah.
that?
Yeah, but I mean, longer term plans for health, like, or how do we fight back now to say, like, this is a problem? Like, I feel like we're all just sitting around twiddling our thumbs. We're not doing that, but that's what it feels like we're just letting it happen, okay? Like, is there any kind of like, no.
I don't know how to intervene. I mean, you mentioned our attorney general, you meant there's a judge that put an injunction on the freeze, so some of those
Slowing it down,
mechanisms
right.
are happening.
Yeah. NACHO would jump on.
I haven't had the bandwidth to see what NACHO is talking about.
Yeah.
NACHO has at least reached out. So there's the New York State, and then there's the National Association of Sitting County Officials.
Yeah, before there was always this sense of there's something that can be done. And right now it just feels like no matter what we would try and do, there's nothing, you can't change it. Like, you go to your congressman, you can't do that anymore. I don't know it feels very hopeless, like all of these important things are being taken away, and the people that would normally protect them and allow them to stay and say like, no, you can't take those things away, all of that's gone.
And I feel like the people that are protecting are either working on it and then but it takes time, because they don't make flip rash decisions like the president does now, or they're not doing anything, and then both is hopeless. I'm in the same.
I mean, I think it's gonna come to the courts,
Yeah.
frankly, that's my personal,
Your thoughts?
Sarah's personal opinion,
Yeah.
because I think I think it's illegal.
Yeah,
I just straight up think it is, I think it's a separation of powers issue. Tell me if I'm wrong, but that's my personal opinion. And so I think it's gonna go all the way to the Supreme Court, and I don't know what's gonna happen there, I'm just saying,
Yeah,
like,
because-
that's. And you know, our Attorney General for New York State is part of that fight, so like in that sense, it's good. But I don't, I mean, the memo literally says we wanna make sure that all the federal funding, you know, as you know, the people of America voted for the president, and we wanna make sure that all the federal funding, but it's like, no, that's not how it works.
Yeah,
Like-
right.
Like basic civics is that Congress holds the purse strings, who are also elected officials and have ideas about how funding should be spent. And a lot of these grants and funding sources are legislatively mandated. So the executive branch, there again, Sarah's personal opinion, not an attorney, like, they just can't take it away.
Yeah.
Right?
Yeah.
So, I mean, we're in the same boat, like, I think we figured out around like 20 staff that need to be like laid off or something, right? And we're talking about our budget right now, so it's a whole thing, but it just doesn't seem legal in my opinion.
It's my concern is how long does that process
Right.
take, and what
Right.
happens in the
Yeah.
limbo? You know, are we laying people off to just bring them back, or maybe out them when we need them, don't know.
All the DEI officers paid off, right? April, I'm sure this is affecting you as well, yeah?
It is, it will potentially hit about 9.4 million. And that's not even looking at the state cash and dollars, that the money was mentioned earlier. So it definitely will hit us, and it hit our providers as well, on the individual level, that we'll have to get more of an assessment from the providers of how this will impact them. Everything that's just going on, I have to say I am worried, and I'm generally not too much of a, not too much of a worried person.
Yeah.
But I'm, concerned that the suicide rates will increase, the mental health, services and addiction services will continue to be required, which we already are struggling to maintain what we have for people now. I think that, is this recorded? Yeah, okay. So, I think that it's just gonna be very interesting to see what happens, especially with the Supreme Court and the fact that it is stacked based on him,
Yeah.
stacking it. So I think that to a certain extent, he is the CEO of federal government. So, he'll do some of this stuff that he's doing. It does need, Congress and some support, from them, but there's like a fine line that, again, that will start to become going through the litigation, and I'm not an attorney. And what I'm saying is not words or affiliation of any organization that I'm a part of, or the county, but those are some of the things that it can be drawn out and long. Perfect example is the loan forgiveness. A lot of people were put in forbearance, and they can't even get out because of all of the litigation and stuff that's happening. So people are inquiring, or their actually interest is being added to their student loan, and they can't even pay it back. So there is gonna be quite a bit of tension for a while. So it's really kind of buckling up and seeing what happens, because we just don't know. So those are just some of my thoughts with it, but it's that the Supreme Court is his.
Your office also covers those with disabilities, and I know that that's a big, it's been a big target for the Have you seen a difference in, or anything come out that's affected those with disabilities that you're having an eye on?
To be continued, on that, and the reason why is because, New York State OPWDD has decided that they will take majority of their funding and they will send it directly to providers or it will go to the state. So they just recently came up with their strategic plan, and we don't know if that's going to be, interrupted because of this. And I don't know how much of state dollars are off of federal dollars that are not passed through. But I will say that a lot of our providers are concerned because they do receive federal dollars. They also receive, Department of Education dollars. So that's also a concern that's up in the air as well. So I don't have an exact number, but I think everybody's just on, pieces of needles, saying what's gonna happen, which means it's increasing people's anxiety. And again, like I said earlier, what helps quickly is substance or unhealthy behaviors, which I don't advocate for. I don't want that to be the case, but this is really intense. And I have not even talked to providers yet to see how deportation is affecting their programs as well. Reading newspapers and listening to the news, I'm hearing that even some superintendents are given, I can't say Monroe County, but outside of Monroe County, I'm reading that some superintendents are giving lists of their students who are undocumented to ICE and saying these are the folks. So again, this is gonna affect behavioral health services because people are not gonna wanna come to services either. So the discrepancy is going to continue to broaden with the minority population.
We fund the Rochester Hope, and the director was saying, well, our main concern right now is just protecting the people that come and get service, because I've got 400 refugees in my place at any one time, and at any point they're all in danger, and things you don't want to think about when you're giving out food and supplies, right?
And 42 CFR Part 2, it indicates that probation or legal can't go into a building to grab somebody out. I don't know if that applies to, kind of ICE. I don't know if once somebody walks into the parking lot, you know what I'm saying, that would be something different, but then you have all of the people around us witnessing all of this. So I didn't mean to change the subject, but all of this is part of just what's happening on the executive level, that people are really holding their breath.
Well, I think that's part of what's contributing to this feeling like we can't do anything, because it's so big and so affecting so many systems that and very little information. So it's hard to know.
We're really off target from our commissioner report, but I know you. Is that where we were? Running. What happened? Really long welcome there, Dr. Akar. I don't know.
So,
Yeah.
obviously, more to come as things clarify, but maybe we'll clarify, I don't know.
Maybe.
We're just gonna keep working until someone actually.
And let me just pause for 1 second that Mark and Gal, Mike and Emma are new to our board, our new members, and Dr. A is here sitting in as we voted last month. So Gal's the president of the city council, and Wanda runs the FQHC Jordan Health.
Such a kind statement.
And for Miguel and Linda, we are recording today. We're testing, we're not yet broadcasting, but we're testing out the equipment, so it is being recorded.
In other news, yes, we had like 60 some odd applicants for my executive secretary positions. I need to pick one so fast. We finally have one viable applicant for the deputy commissioner.
Oh, good.
I'm running through her application and hoping that we will be able to make an offer sometime soon. I had hoped, but don't have yet, the summary report from our cure violence consultant. It's almost completed, so I hope planned to have that to you all before our next meeting. Ditto for the end of year accomplishments and challenges. That summary, it just hasn't happened, and so I'm getting help from me and to just get it all summarized and written and to present that to you all next time. I guess maybe one glimmer of hope I will share. After more than a year of waiting for New York State to sign their own data use agreement with us, we have finally received, we signed and like blessed and everybody has agreed copy of an agreement that should give us access to NEMSIS, it's the National Emergency Medicine some system. Basically, it will give us access to 911 ambulance reports, and so that should be able to give us more accurate, real-time source of numbers for overdoses. And so we've had lots of discussions around this table about the different sources of data and not wanting to have to wait a year plus for the medical examiner's report, but lots of the implications to some of our other data sources. So hopefully my team will, they've already started playing with their first download of the data, so we'll see. Not playing, I need to consider how I speak if we're gonna start putting this out. They are analyzing the data and cleaning, scrubbing, figuring out how we can best use it, and then we will at some point update our opioid dashboard to reflect more timely, accurate numbers. So that is one positive thing here. Yeah. I tell us who the commissioner is. Good luck with that. Oh boy, they're good people. We need that. Where are you? And you're happy to do it on the side.
You have extra time. Right. So much time.
Other questions for Dr. Murray? Good luck to you. If there's any way that the board can help in all of this, of course, you know what side we're on with the boards of things. Yeah, right. Line at the next board meeting. Oh.
Did I hear that we're back on again with the social care network and the health department's involvement?
Don't do that, no. Nobody told me.
Let me check on that because I know it was on again, off again. But I thought I heard that there'd be some opportunity, for those who provide services, which makes sense.
I thought hospitals and
without, yeah.
government entities were.
That's what they're saying.
They're not intentionally excluded, but to jump through all the hoops is gonna require some major changes that may or may not be worth it. There's nothing that says you can't.
Well, no, it's more like
There
we can
was
get
some-
paid for it. We can do it.
Yeah, well, we already are doing it.
Right,
But we're
what I'm saying
doing
is
it
that
on a-
that was the takeaway from that,
Yeah.
one meeting we're at, is that we wouldn't get paid for it.
Yeah, hospitals
Yeah,
can. I know.
Initially, they
Yeah.
said yes, and then they said no. So that's why I'm like, are they back on yes again?
I know the
Reach out to
latest
Patty.
new guidelines is out from Department of Health. New York State. So that just came out, I think, about a week or two ago. It was constantly changing.
I will reach out.
But Oh, for the. Any other questions for? All right, moving on to President's report. Brendan is not here, but I did want to, again, mention in the membership, while we have our new two people, excited to have that. The next person up for expiration is, yes, Miss Beth is leaving us sadly at the end of August. But she is the only one for this year, and she is an at-large position. So remember, it took us a minute to kind of get some lovely applicants for, to get that system worked out. So I don't know, Megan, if we ever put on the website, I meant to check before we came today, but kind of a standing request, if you're interested to submit your CV. That was the request of the nominating committee, yeah. Just to kind of have the information up there so that if people were perusing, they could see what a board position means, and if they were interested, they could just at least contact one of us or upload to something, that would be great. But if you know people, particularly that address some of the concerns of the commission last time, some of the concerns were almost valid. we need some we need some elderly representatives, and I'm like, we're all old, I'm old, do I count, right? I'm like, I've got the elderly freaking on my side.
Why are you saying right?
Yeah, for me, not you, for me. And then, they made a comment about military, and obviously, Shad is definitely post-military, how do I say that?
Sure.
Retired military, thank you. So, that is a valid concern, but the idea behind the board is diversity of thought. So if we have groups that are not represented, please let's bring them in. And we certainly discussed mental health being something coming that we wanted representation of, which brought you here. So have that in mind this week. I'm not even gonna say replace, but find a new person to take the spot for sadly,
Sorry,
yes.
so isn't the nominating committee, isn't that like you and Bill?
Yes.
From
Exactly. So if
Sorry,
we
I
wanted,
should've finished that.
thank you, so if we want to create a nominating committee to kind of take over this next iteration, that would be great. Anybody wants to volunteer for that? Sarah seems to have an interest.
Sure.
Sarah. And maybe 2 or 3 of you, anybody wanna join Sarah on that? Nice. Hey, thanks. One more? Also query Celia and Albert. You're not signing up for one more. One more thing. Albert can't do another thing either. Oh, and Celia, yes, definitely. So friends.
And this is my second term, so I
Correct. All right, so I will send an email, but one more person would be great, just to keep things controversial. Well, that's the next thing, so, and I have to send Brendan an email about this, but in 27, there's 2 of us coming off, me and Aaron, and Albert is for renewal. And then in 28, we have 1, 2, 3, 4, 5, 6 people that are out. So, or 3 to be renewed, 3 leaving. 26 is 1 person. It's 26. 26, Sarah Fletcher. That's you, babe. And you're expired. What's that commercial with the ants? Progressive commercial, sorry, running through my head. So, we talked about maybe staging those of you that are due to come off in 28 so that we don't have a giant drop of half boards. I'll be gone, so it won't matter. But maybe we can do some mitigation now. All right, we wanted to give some time to kind of get acquainted with our new board members, and then also with Dr. A being here, getting an idea of what the Office of Mental Health is all about. Like several questions came up when you, not about you joining us, but about what do they do? Do they have a board? How does that work? So figured it'd be great to get that presentation. So I don't know if you guys want to take 5 minutes each, just tell us what you're up to and what brings you to the board and what you hope to impart on all of us, and then all of that, all your wisdom, and then we'll switch over to Office of Mental Health.
Is that good? Okay, I'll make it up and you can fix whatever I do wrong.
Absolutely.
Okay. Again, my name is Mike Weston, Executive Director of Kids Branches. We're a small FQHC lookalike in the 19th Ward. We also have offices in Beechwood. We serve about 3,600 patients annually. The bulk of those patients are Black, African American. Another about 12% have been an awesome partnership we have with Ibero, Spanish-speaking individuals. 7% of our patients are refugees at this point, so working through our own ICE regulations and third-party visits. Then another 5% of our population is part of the LGBTQIA population. So that's the batch of individuals that we serve. The bulk of them are publicly insured, Medicaid, Medicare, and then we have anyone who take care of mental health in our office. We do collaborative care. We're about to start a psychotherapy program this summer as well. We'll be able to serve kids as young as 3-year-old into our mental health program. So we're excited about getting that underway. We do refugee health assessments in our office as well as primary care. And then we do laboratory services, pretty much anything else needed case management. So that's what we do at our office. And then myself, I'm married, my wife and I have been married for 20 years, working on a 20th anniversary trip. I have to take her somewhere. I'm currently researching that actively. Then 3 kids, 15, 13, 11. Have all lived 1 block north of the city of Rochester. So that's what it is. So I've been in Rochester 12 years and love everything that Rochester has to offer, and the things that we don't like about Rochester are the things that we're passionate about changing. So that's what we'd love to serve. So excited to join with y'all and serve in the community.
Where were you before you came here?
I grew up in Missouri, a long way from everywhere, and then lived in Pennsylvania for a while and Massachusetts, so been a little bit of everywhere. We were talking about forest fires earlier. My dad actually is a prescribed fire. He works with prescribed fires, so for 40 years he submitted to California projects to do prescribed fires, and for 40 years they've said no.
What does that mean?
So you actively burn troubled areas before you have an emergency fire struck. Yeah, so basically you control that, manage that. Then you don't even have to worry about it, so that the fires are less dangerous.
Yeah,
So,
right. I didn't realize so much went on at his branches. How many staff
yeah,
people you have?
we have about 25 staff members right now.
Wow.
So we have about 4.5 providers is our FTE. Then we have 2 mental health counselors, 2 case managers, and then rest front staff, administration, finances. So we're kind of expanding our buildings this year too. So we'll go from having 7 exam rooms this year to by the end of 2025, we'll be up to 14 exam rooms in our 2 locations. So, I spent most of my day outside measuring stuff. So yeah, in the rain.
Well, to have you here, what are your thoughts on abortion and transgender health and immigrants that know? Obviously.
We'll say that for the next political vote, right?
Yes. Yeah. Oh, well, we certainly could, but we actually at one point said we were gonna sort of give little mini presentations. Yeah, and I think Erin is almost first up on the agenda. I just asked Megan about Adam Bello coming to talk to this group, because that was another request. So whenever I get him penciled in, the first next stop will be Erin talking about, and maybe we can even double up and have 2. I agree with you. Look at her more.
I'm Emma.
We all know what you do.
A lot about you and the rest of the county know a lot about me. I am a psychologist in private practice. Came to private practice through Children's Institute and U of R and other places, and then needed to work for myself. So that's what I've been doing. I am child and adolescent trained, but in about 2010, took an adult who had gender issues, and 1 person, 2 people, 8 people, explosion, realized I needed more training, so took a year or 2 to go to every conference I could. And then eventually hit the point probably in about 2015 where I shut my practice to most other concerns and became exclusively gender health, because at the time I was the only one doing it. And I have an adjunct faculty position at Strong where I teach, supervise on and off other interns and postdocs. Now teach some workshops. I'm also on faculty at SUNY Empire State where I teach 2 classes online, which I don't particularly like, but I also love it. So it's a mixed bag. The rest of you see these like public. Any questions about that? You can look at it. I have 4 children. They are 23, 19, 18, 17. 2 dogs, 2 cats. No trips in my future.
Busy house.
Yeah, right.
Yes, they're delightful though. I love that. Put their dishes in the
pick one.
Can you just talk, if you feel comfortable talking about a little bit about what you're hearing from your clients about what's
It's a
going
shit
on?
show, pardon my friend, we're not being, it's been a really.
We are being recorded.
Yeah, I was
gonna say, oh, we're recording.
Not public. Yeah, it's been a very difficult week. Panic mostly amongst non-adults. I feel fairly good about the kids and teenagers even, partly because they have been appropriately treated, both socially and medically in our community, and so it doesn't feel real, if that makes sense. And that speaks to the adults in their worlds, right, who created a sense of safety. And so I'm riding that. I'm not getting them all riled up. Adults, on the other hand, either of gender expansive adults and the parents of kids who are gender expansive are scared. There's other clinics, not locally, but other clinics, including those in blue states, are canceling appointments, turning people away, even though there is no law yet, right? And the inability to have an X on a passport as of last week is a little concerning, but also everyone's perceiving that's the tip of the iceberg, and hearing stories of people not being able to get their paperwork back, and they might get it back, but they've lost their application money. People are packing go bags and figuring out how to get into Canada. I in my practice probably see about 50% of the youth and the kids I see are on a form of Medicaid or part Medicaid, and that is likely to not cover any gender health, and so people are worried they're basically losing their insurance, although we're brainstorming some ways around that. So it's without information or just vague kind of threats, although I don't think they're threats, but there's no information. The court system hopefully I have no doubt, will attempt to maintain things the way they are. Don't know if it'll end in a way that's helpful. It is going to be drawn out. So I'm kind of working with people to turn off the social media and the TV and to keep your eyes on who is in front of you. And those are the people we're attending to, and the cell. Because it's scrambling all over. I actually had a meeting this morning with 20 Episcopalian ministers from across the country. And if nothing else, for the first time, everyone's equally scared instead of a red state, blue state divide. It's not a good thing, but it is, it's good to hear experiences from people who've been living with it a little longer. And they're scared. And so OMH and the increase in suicide stuff is a very real possibility. That is almost every adult I work with who doesn't have children, that is their backup plan. Can't roll over the camper.
So I can share a little too. My daughter's transgender, and she's 10 and has identified since birth, basically, like since she could tell us who she was. And we did get a call she gets her care in Boston. We got a call saying that they are halting their program. So she's almost on the cusp of needing medication, and we are very afraid that we're not going to be able to get it for her. So we are looking at options out of the country, and it's been a really difficult time for us as a family to try to figure out how we can support our child, but the option of her turning into a boy is not an option for us. So we've got to figure that out, and whatever that's going to look like, it's going to look like. It sucks. It's terrible, and it's terrifying.
I did see that the New York Times had an article that a New York hospital, there are 2 children there. So,
and they're
Gender-
scrambling.
Gender affirming,
Care,
yeah,
just
care, really.
Yeah, they're scrambling in the same way when they hear, we're cutting it off, we're gonna make it so the doctors will jail and all that kind of
Yeah.
stuff, and they're like, ooh, scared, and they shut it down. And Strong, on the other hand, has said, heck no, we're moving, we haven't heard otherwise, so we are going to continue.
I think the scary thing is I thought we were in a safe state. And that's where the fear comes, because I'm like, okay, regardless of what happens, we're protected in New York State. And now I'm like, we're not. So what do we do now?
I mean, it makes me so sad, and I'm so sorry your family's going through that, but, it makes me angry that people think they can just announce that this is the way it is, and now your kid feels differently all of a sudden. It's not that, you know, it's like, you can't just revert back, like, that, this is your identity.
It's the addition in addition, an executive order banning transgender people from military service, which is not unexpected and has happened before. However, the difference this time is the language that was used, implying that such people are liars and deceitful and should not be in the military because they don't uphold the standards of our country. And that did probably more damage than anything else. Again, words.
Miguel, how's things at Ibero?
Mm. What was the question?
Oh, and, you know, watch what you, say what you're free to share, I just.
Yeah, no, I never scared. You know, we've had a rough couple weeks, obviously. There's a lot of concern and things have been happening. And then you have families that we know of that have been visited. I am aware of a situation not in Rochester, but in Albany, because we have a presence here in Rochester and also Amsterdam, Albany, and other areas.
Take care, Beth, sorry. She's not leaving for us, she's.
No, I didn't have to go.
Where someone went to their ICE appointment, which was a standard check-in, that they've been doing the entire time they've been in this country, and this time they were kept. And we're still trying to understand, other than the change in administration and dynamics, if there's any grounds for that person being kept. We also have heard, and you know, there's been a lot of concerns about understanding what the tactic is on the ground. So I know some of that, which happy to talk to folks maybe outside of this meeting about, but and generally speaking, it just feels like this is a lot of fear being pumped in the community. We haven't heard of many situations where people have been detained yet locally. It's not to say it's not happening, because I'm sure there's been people that have been picked up. But thankfully, many of the families that we've been engaging, we've been focusing on educating them, knowing their rights, knowing what they can do, what they should do, and what they should not do. And lots more to say, but
Yeah, no, I appreciate that. And Celia, I'm sorry, I didn't interrupt before, but this is Celia, she's on our board as well. And then Mike has joined us, and Dr. A's from the Office of Mental Health running this. So, yes, here. And feel free to join us here. I'm wherever you're comfortable, yep.
We don't do this like.
Brendan's here.
I was late, I got a sick kid at home, so juggling parenting duties.
Yes. They virtual. We don't wanna talk about it. There's no disease anymore, didn't you know? I have to watch myself.
Please do.
Yes, exactly. Just get me under the table, please do.
Brendan said that,
He's like, not while Teresa's in charge, please. Well, it's scary times, and honestly, it makes me nervous and I'm not having to talk to people day in and day out. So I really commend those of you that are. That'd be scary for yourself, and then how do you convey confidence and safety to folks that maybe don't have it anymore, so.
I'd say one more thing about
Please, yeah.
the whole immigration shift. So the one thing that's concerning me and the general public is the amount of misinformation that has come down from the federal government to local people. Then they believe that everyone who's here is here illegally or
Yeah,
a
right.
criminal or whatever the case may be. And the frustration is that we as a community haven't stood up, and I'm working on myself too when I say this. We as a community haven't stood up and said that's wrong and it's not true. And we got to keep fighting and pushing back on that, because the vast majority, when I say that, I mean 99% plus probably, of individuals here are here legally from the perspective of they crossed the border, they sought asylum, they got another status, temporary protected status or something else. And while it's certainly, I'm sure there's many people who also come here different ways, they're complying. They're complying with what the federal law is. And it's frustrating to see and hear locally, and you know, unfortunately I pay too much attention to social media, which I need to stop doing, but people just have the information wrong. So I think as a community, we need to start combating misinformation that's out there.
Can I ask about the cards? And again, if this, I don't know anything other than students have asked if they could print something, and I said yes, but I don't know, is that a political thing or that's just a know your facts kind of thing?
No, you're right.
Know your rights, the red
Yes.
cards, yeah.
So a good thing too.
Too, that I'll have to find it, that it's kind of handy because they're like 32 languages, but the red
Oh.
card comes in multiple languages too.
Yes.
I want to get my hands on English, so Angie said she would get it. I said, just give me one and we'll get it printed.
Yeah, right.
Oh, it's actually all on the website. too.
Yeah, so we got
Okay.
some from World Relief, had a whole, I think they have about
Okay, and
20 or 30.
PDF, okay.
I have students that work with asylum seekers to do their physicals and we're open to.
The actual cards are in back order.
Are they?
Get them printed.
Yeah, you could get one or two off the web and then. All right, well, thank you all, appreciate and welcome again, appreciate you guys being here, so.
Meeting normally isn't such a Debbie Downer.
I know, this sad one, goodness. Remain hopeful and helpful and wanna do what we can in our county, however, whatever that looks like, so. Sadly, we don't know what that looks like just yet. It's away. But thank you for joining us, Dr. Aycock. We're thrilled to have you here and thrilled to learn more about Office of Mental Health, so take it away in our remaining time.
All right, so I have some slides I'm just gonna kind of skip through and so forth, because I think you all may have questions.
Yeah.
So I want to leave that. So,
Now, hold on one second, are you connected or no? Up there?
no, it's okay. I'll
Okay, you're just gonna read from.
I'm just gonna.
Got you.
So, our office was really created after the deinstitutionalization of, hospitals, and so that was, 1960s to 1980s. They were really doing rapid, just, deinstitutionalizing of folks. This resulted in, of course, unhoused population, lack of continued care, and unmet needs to a lot of the serious mentally ill, population out here. Our inpatient population, meaning state inpatient, in 1955 was 93,600, and today it's roughly around almost 3,000. So it's actually dropped quite significant. When that happened, the state was all in a 50 of, hey, who takes over what population, and you start having a development of the old agencies. I won't go into the history of old agencies, but part of that became local government units should be created, and this office should be created to pass through dollars and funding for community-based organizations. And not only would be funding, but it would be that local level to oversee what's going on within the community. So the local government unit is only one in each county. And so, so that's how the LGU kind of came about. 1993, is when Strong Ties was created. So they was a part of that whole initiative of community-based services. And so Strong Ties, when you think of that, that really was in partnership of the LGU from the state, which we're super excited about. In the 50s, that's when it became antipsychotic medication became available for folks. So again, it was more of pushing people back into the community and the community taking care of these folks instead of the federal government taking care of the folks. LGU, my statute, so statutory authority is mental hygiene law 41. 41.05 gives the specific responsibilities of our office. So again, just to quickly summarize it, we are to oversee all behavioral health services, which means includes addiction, mental health, and intellectual development and disability. I like to look at it as more of a shared governance model. My office does not go into programs and say, what are you doing? We have the authority to be able to do that if things aren't being, provided to our community. We can audit organizations and stuff like that, but we really try to leave that to New York State OMH or to the OPWDD because they audit as well. We also have to develop a local service plan, which is kind of an overall behavior assessment of what the community needs. It becomes published. That then goes into the New York State crisis, or I should say crisis plan, but their plan, call it 503 plan. And that goes up to the governor's office. And the governor's office, they say, these are the things that we're needing. And so they take it and they look at every county. And so it goes into a system and they take what is a common thread for each county. So housing is always an issue, opiate, epidemic was an issue, children's services was an issue, and so forth. Make sense? So part of my office, we've had 8 individuals. Actually 5 DCS, which is Director of Community Services, which is me, from 1988 to current time. We've had some vacancies and people were acting directors, but they wasn't, kind of sworn in and so forth. The structure of the governance, just on a New York State level, we have, of course, our governor, and then they have to report, go through the legislative process, just like the local county level, meaning that anything that is being approved funding wise is going through the various committees on the state level, and the assembly members as well as the Senate is all reviewing that. So when you heard the governor talk about mental health services and $1 billion that is proposed, that then has to be presented through the committees, and once that gets passed, then that can estimate and send out money. And so the commissioners for each of the old agencies reports directly to the governor. And then our office, we get funding from the state. We do not report directly to the New York State Office of Mental Health, OASIS or OPWDD. Make sense? Yeah. And then part of the state, they have state facilities and state hospitals, and we don't necessarily oversee those because that is the state program. However, we work very closely with Rochester Psychiatric Center and so forth in all of the state hospitals. And then we work with community-based programs and hospitals locally. When we talk about just specifically for Monroe County, of course, we have our county executive, and then we have our county ledge that we have to get budgets approved and vendors approved and go through all of that process. And then the hierarchy is the county executive, then deputy county executive Jeff McCain, and then the Office of Mental Health actually falls underneath the Department of Human Services. So Thalia, I report to Thalia, and then it's my office, and I have the Community Service Board, subcommittees. So by statute, we have to have a Community Service Board. Some counties, the Community Service Board actually hires and fires that person. Our county does not do that. We're appointed based on, the county executive. And so this board is an advisory board. And so they really advise me on some of the initiatives that we're doing, and so forth. We also have a subcommittees, we're required to, based on statute, have some of those committees, which is mental health, addiction, and IDD, which is intellectual development and disability. I have roughly 60, I want to say between 60 to 64 staff members. Majority of those staff members are CCFI staff members, so they provide a lot of support for us. And then we, like I said, work very closely with the community-based organizations and hospitals. We have over 94 programs, over 31 providers, and we oversee over 100 different services within the county as a whole. So constantly busy, we're juggling that, but then we do internal work as well. And we have a priority service department, which we have split it up for adult and children. And so you may hear single point of activism, and that deals with a lot of the housing that's associated with mental health, but they also have case management they provide support with on the adult and children side. We have rapid engagement delivery services, which is our RED program, we call it, and that is to really handhold folks who are a part of DHS that are struggling with getting on Medicaid to get services. So they either start an application, then they stop it, and then they start it again. So we really try to hold their hand. We have a trauma, illness, and grief group that we work with the school districts on. And we have juvenile justice, mental health. So we have 2 clinicians who work with probation to do mental health assessments. We have a spreading wellness around town, which is a youth kind of committee, youth team. And we do a lot of open mics and just engagement with them. What I like about this group is that we actually was able to have them give us ideas to help CPAP. So they created a brochure so that family members understand what they're getting into when they have to sit into a CPAP for 3 or 4 or 5 hours. So anything, so we have a ACT program, that's student hillside, a youth ACT program. And that program, as it was being created, we asked the young people for their opinions and thoughts on that as well. We have our adult outpatient treatment program, and that's through Kendra Law. And so these folks are court ordered into treatment or to take medication. It's not punitive at all. So if they show up, they show up. If they don't, but we try to provide whatever support that we can. And some people are very successful on this program. We have a transition management team, which goes within the drug court, mental health court, works very closely with Judge Elliott's team and try to connect people to services. So when you think about our office, think about as connecting to services. We have outreach workers that are actually going out in the community, trying to share awareness about mental health services, addiction, and intellectual developmental disability. Last year, we launched our app. If you don't have it, download the app, but that was, another form of just the outreach. We have, of course, our FIT team, which is the forensic intervention team, and it's a co-response with law enforcement, but we also have a clinical case management department as well. That's a part of our forensic team. We have care coordination, which, contract coordinators, I should have said. And these are folks who manage our contracts and our deliverables, and they work very closely with providers in the community, so we know that we're getting what we're getting. Very proud of this. I often mention this, but at one point during COVID, the University of Rochester's partial program actually was 100% Zoom. And then what they did do was they was bringing people in the office, giving them a computer, but it was still 100% Zoom. Got a lot of feedback from people in the community, people outside of our community, concern about a doctor saying we're not referring people to partial. Partial was saying, hey, we're seeing good numbers, we're seeing success and so forth. So we had conversations with them, had conversations with the state, and when you look at the regulations, partial is not a Zoom. It cannot be a Zoom program. It has to be an in-person program. And so we worked really hard with the University of Rochester and the state, and we got them to bring it in person. So those are some of the things that when we have to say to providers, we're able to do. The Child Council is now opening up a mental health clinic for children and their families and adolescents. Again, they came through our office, asked us for permission. We was able to provide that for them. So We do quite a bit, not only internal but external as well. We have a fiscal management team as well that is managing the budget, which our budget is roughly, I believe, $58 or $59 million. Most of those, again, are very restricted pass-through dollars, so when people see that, they think, yay, we got all this money, and it's like. We also do 730 court order examinations, and so that's for competency, so to see if somebody can withstand trial or not. We oversee safe acts, as well, so that's a little bit of what we do. I had numbers, but I won't share, all the numbers, so just our programs. I also, have designees. So these are folks who are able to do 945s in the community, on my behalf. So they go out for me as if I was there. So that's about it with the programs. I won't go over my strategic plan, but do you have any questions? Try to leave enough time to answer some questions.
Yeah, that's great. Can you say again about how Oasis, OPWDD, and the third thing, how they work? Is it OMH? I missed the third one, but those.
You wanna know what?
Yeah, those, so Office of Mental Health is one of the three that are
Correct.
managed, okay. I
So
was
it's
thinking-
3 governing bodies.
Yeah,
Which means that it's 3 regulations
Yeah.
as well that we have to follow, which means that each organization and each program has different regulations as well, and different mental hygiene statute rules as well. And so one of them is the New York State Office of Mental Health, and within all of the 3 organizations, so it's New York State Office of Mental Health, New York State OASIS, which is Office of Alcohol Substance Support Services, they just changed their name. So they can get rid of the stigma, associated with it, and then we have our Office of Developmental Disability as well, so those are the 3 governing bodies.
Gotcha.
But what's interesting with that is they have a central office and they have a regional office. And so regional, some of those old agencies, regional has more control than the central office, and some it doesn't, so it's really kind of the data liaison. And so, so that's just interesting how they do things. And then to throw into the mix of governing bodies is that when you look at hospital-based organizations, their governing body really is, of course, the old agencies, but it is New York State Department of Health as well as Joint Commission. And so some of the organizations are decided that they've asked, there's some kind of arrangements from on a state level that they could actually take their audits, their local audits, and merge it with the Joint Commission, so that when Joint Commission comes in, if they approve it, the state is satisfied with the O agencies. Sometimes it's great and sometimes it's not, so I got some mixed feelings, about that. So I know I gave you more than what you asked for.
no, that was good, thank you. Because we're DOH, right? We're on
Yes, you are.
between,
Because you're
and but we can do behavioral health to a degree, right? We're really up to 20,000 visits.
Yeah.
But, and we fall into that too, so it's with Joint Commission, and I didn't know that, cause I let DOH in and everybody ought to do that slash.
They'll come at once.
Yeah,
Um,
I was just wondering, CCSI, do they provide rent services?
So CCSI entity, I can't really speak as far as like what they do. What they do for us is we contract with them. So they hire our staff, so they're like the contract agency for us. Which is pros and cons with that, of course, but we in my office, the only direct services we do, and it all depends on how you define it, but the direct services I would say is our 15. And and maybe our trauma, illness, and grief team, because we work one-on-one with a client and deal with the current issue. The other departments, really, we see what the issue is and really try to connect them to services. So our office is the LGU, we just in general, we do not have a clinic, so we don't do the direct services. We generally contract out to providers.
and how about your whole outreach staff, cause every time I'm on community, they're out there, that's they're employed directly by you, right?
Yes, and those are actually Monroe County staff. So one of the things that was a part of the race commission was just a lack of awareness that people, you know, you talk about misinformation that's going out. And so part of it expanding, I had said I needed more positions for just to get the word out. And the county executive supported us as well as my supervisors, and we created our outreach team. And so they are walking up and down the street, they're giving out cards, I mean, they're everywhere.
That's kind of what I wanted to ask more about. So its footprint within the context of the city, because I know we have a person in crisis now, which is what, 3 years?
4 years.
4 years old.
Yeah.
How much crossover interfacing is happening? This is kind of probably a joint question. I'm gonna throw Sarah on the hot seat too. How much interfacing is happening? And then, you know, one of the things from a fiduciary perspective that council's been pondering is, you know, when we took on more mental health services as a city, it didn't come with additional support elsewhere. It just kind of became a thing that we took on. And long-term wondering if there's any potential funding streams that the city could be looking at to get support.
Right. You want me to jump right in?
So, if a call comes into 911 and it's like a PIC call and it's in the city of Rochester, like, it will go to PIC. So our PIC's jurisdiction is just the city of Rochester. So we do similar work. FIT doesn't do any like FIT only calls, they're only co-response. But both teams work. Sometimes we have overlap with clients, sometimes if we need like 941s, mental health, they'll call the FIT team in, because the PIC team can't do those. So there's a little overlap, but I would say like the jurisdiction of the PIC team is just the city, and then it works.
So is FIT doing that outreach in the city too, that street outreach that you're talking about?
So it's two different things that you're referring to. So our outreach team goes everywhere. And so when you think about the county as a whole, we are a county program, which includes the city. We have respected PIC and the fact that the city residents are wanting PIC. So whenever they get dispatched out, we just support them if they need it. So that's sometimes where if PIC can't go to a scene, then they will sometimes call us in to go to a scene and provide some support as needed. Sometimes law enforcement will request us. And sometimes family members will say, I want the FIT team to come out. And so 911 will accommodate that person's request. Our outreach team, every day, they are in the city, they are in Rockport, you know, so they go all over the place to provide that level of awareness of what the services are out there. But FIT, it goes, like I said, everywhere. And FIT is not a sole dispatch right now, it is cold dispatch. However, there are times where we go to a scene and it's safe and law enforcement leaves. And if it is there, or law enforcement may say, hey, you know, we have this person, really concerned about this person. Would you mind going over and we'll give the person a call, or we'll say, yep, we'll go over there. Do you mind coming with us? And law enforcement says, yes, we go over. Those are the cases that never is really mentioned, you know, in social media or anything. But we do quite a bit of those, and we can saw a lot with the Rochester Police Department. So the way FIT is structured is we have different kind of quarters or jurisdiction. So I have some of the staff member that will be on the west side area. We have a specific staff person that is specifically for the city of Rochester. And so the way that structure is, we will get quite a bit of law enforcement that will call us. And sometimes just consult with us and say, hey, I have this person. What do you think about this? And we do collaborate a lot with the PIC team. The PIC team, we work closely with Aaliyah. Aaliyah and I meet on generally a monthly basis. We try to meet to see how we can continue to partner. We also have we call it a homicide response team, but the city of Rochester has their homicide response team. We work in partnership with them. And so what happens is they go out to the scene, they, you know, see whatever is needed as support. And then they verbally ask the person, do you mind if we give your contact information to, you know, the county for some counselors? And if they agree to it, Aaliyah gives us a list of the names. We then contact the person at least 30 days after the situation. And we set that up because a lot of times the funeral's over, people are home, and that's when that deep grief starts to step in. And we provide very brief counseling and support for those folks. And then if they need to be connected to services, we connect with services. So we work very closely. Our relationship with the city is very healthy. There are times when unfortunately we can't give a lot of information because, as you stated earlier, it is a city program. It is not governed by HIPAA. 42 FR is not governed by the licenses of OMH or OASIS and so forth. So that's FIT, because FIT falls underneath the local government unit, which means that we oversee, all of those programs. And so, as far as like funding, right now the state is not giving out any state aid dollars. Now, state aid dollars generally are reoccurring dollars. What they're sending out is more of some of that $1 billion they're doing RFPs. The problem with the city's program is that the RFPs, generally they say you have to be a licensed program. So it excludes the city or any other crisis program that's out there that's not associated with a licensed clinic or program. So I would say, as far as like funding sources, either consider going licensed to a clinic or decide, that's a lot. That is a lot, I'll tell you, especially because there is a component of collecting insurances, and you all are appreciated. Dr. Clark will appreciate it, but a lot of times with programs, when you do the auditing, if the documentation isn't right, you wind up paying back. And you don't ever want to have to pay Medicaid back and so forth. Or grants. See what grants is out there. There's a lot of stuff that people are saying we want more services and we want it to look different. Did I answer your question?
More than answer.
Does FIT go out mostly with the sheriff or is it with individual police departments or both?
They go out with all.
I'm just curious, like, do
police, yeah.
you have any like sense of what percentage is like the sheriff versus the town police officers?
So we have different staff that, again, if we're looking at the east side, then they may go to Fairport, Greece. You see what I'm saying? So whoever gets the call, then we'll go out with them. So.
You go with the dispatching department or.
I mean, that's the
Correct. So what
benefit of
happens is-
having 911 dispatch the whole county.
Yeah.
And what we did do was, before the way FIT was that the police would get on scene and then they would call us in. We changed that where now, once a call comes in, then we get dispatched right with the police. And so we get generally at the scene at the same time, or we get there earlier and we wait at a staging location until law enforcement comes and then we go into the house.
But it sounds like you will do some wellness checks.
Yes, we do wellness checks.
I was actually gonna ask you, and this is like a little bit in the weeds, so we don't consider, but I was actually gonna ask you about how the homicide counseling is going.
Any other questions?
I just wanted a quick question about the IDD population.
Yes.
How does that work? Because with your relationship, because oftentimes we care for a lot of them in the hospital. And then I know when we're talking about certain care plans, we have to, like even when we call palliative care in for certain things, we have to get you guys involved because they're kind of like a ward of the state. Can you talk a little bit about that process?
Yes, so it's a little bit different. So when we talk about like a ward of the state or guardian, that will fall underneath Department of DHS.
Okay.
And so not the Office of Mental Health. We don't do anything with guardians and so forth.
Okay.
CPS does that, adult protective services and so forth. So when we talk about kids who have IDD concerns, that goes a lot. And talk about guardian, that goes underneath the Office of Children and Family Services. And so Steve, who is the director for the Office of Aging here at the county, he may be a good person, to maybe bring in to talk a little bit more about just the adult population. We get pulled in as one of those entities to say, if this person is meeting the criteria for IDD, how do we Is there a group home available? Is there a state facility available, which generally it's not because of the way the state decided they wanted to control that. And then we will at times bring the regional or central office in to say, we gotta have a care coordination meeting because this person is stuck in a hospital. And we have to figure out how to help this person out. The issue with, when we talk about IDD, as you know, Doc, is that you may see somebody and you know that they are intellectually developmentally delayed, but they were never classified. And so once, if you're not classified, then OPWDD is gonna say, nope, we can't touch that person at all. And then it becomes mental health issue or addiction issues as well. And so, did I answer your question? Sorry, I can't give a exact, this is the direction, this is what you do, but we try to at least come in. And I always say it's called like a complex care or care coordination meeting, which allows us to be a little bit more flexible with what information we give because it's protected underneath mental hygiene law 3313. I'm smiling because my attorney is back there. He knows very well.
I'm their attorney also.
I'm smiling because I've been trying to do a schematic of who gives mental health care and no wonder I can't figure it out. There's like 18 ages. Oh no, that's a special caveat over here and that's this. And it's
And it becomes
so.
hot potato and who takes it and it just becomes a lot. And unfortunately, the hospitals are now the structure where everybody goes. You can't turn them away with Intella and they become the nursing home, they become the state facility when really they need to be pushed out into these services. Yeah.
Emergency medicine, the law that says you can't. You can't.
EMTALA. Yeah, EMTALA, I don't know how you pronounce it, but can't turn away somebody who needs emergency care.
Oh, really?
So yeah, we're talking more and more about it, and so if somebody comes to the emergency room and they want services, they have to receive services. The hospital can't say, no,
Yeah.
we're closing the door, you go somewhere else. They can't do that.
We need to move to adjourn just for time wise, but I'm sure we can continue conversation. Dr. Acock and I wanna just make sure that we don't have any follow-up business to take care of with the Tua stuff.
I'm not aware of any follow-up, no.
Okay,
We'll keep you apprised though. Thank you.
Anyone have a motion to close? Thank you, Linda's ready to go. Second by Miguel or Celia, everyone agree? Yes, and opposed? Okay, so thank you so much for your presentation